Hi, Kansas City moms. I am here with Dr. Gabe Schifman of the Pediatric ER at Overland Park Regional Medical Center, which is part of HCA Midwest Health. And we are here to talk about all the seasonal illnesses. You know, kids are back in school or in daycare, and they're passing it all around. And we've definitely seen, I feel like in the headlines, RSV just seems to be rampant all over the country, and especially, Kansas City, we've heard about it. Can you just explain what RSV is and what you're seeing in the ER?
Absolutely. So first of all, glad to be back with you guys. So RSV stands for respiratory syncytial virus. We say RSV because syncytial is kind of hard to say. So it presents like a common cold. It's a viral infection. It attacks the upper and sometimes lower airways. You can have fever, you have cough, congestion, increase work of breathing in the little ones. The reason why that it's concerning and why this is kind of why people know about it more than just the common cold is for the very, very young and the very, very old, it does wreak a little bit more havoc on the lungs and makes it difficult for them to breathe. So a lot of kids who are struggling do need supportive care, oxygen support, high flow support, just to give them the extra help they need. So because their lungs aren't doing the jobs that they normally do or can't do because of the infection. So we are seeing a lot more right now. Our emergency departments are setting records every day. Our inpatient floors, both the general pediatrics and as well as the PICU, are full, mostly because of this virus. And the reason I think it is, I mean, it's seasonal. So, everyone's kind of, coming in from the outdoors because it was nice outside, it's a little bit cooler. So people are kind of more huddled together. There's also school that's back in session. So there's a lot more exposures at school. And the fact that we've had COVID for the past 2 years is kind of waning. So the fact that COVID is kind of going away, people are more lax about their, their caution, I guess, in terms of wearing masks and hand washing and gatherings, all that's kind of going away. So all of these kids, especially the little ones who have not been exposed to anything over the past 2 years because of quarantining and behaving, now that they're out and about, their immune system has never seen these viruses before, so they're getting sick because their body has to respond, and that's what we do when we respond to a new illness. So that combination of everything, weather, timing, the end of COVID, and just the young kids not having their immune system strong enough, it's just a perfect storm for what we're seeing in the emergency department right now.
So is there any way to prevent RSV?
So there's a yes and a no. So premature babies who have a long NICU stay, some of them are eligible for a RSV immunization shot. It's only for the very, very premature and like compromised children. So that's a question that you talk to your primary doctor for. Normally, you'd know that even before leaving the hospital upon birth. But for the kids who have left that stage and have gone home with mom and dad, there is not a shot that's available for the public. It is a cold. Like every other cold, we want to limit exposure to people, especially if you have any kind of symptoms. You don't want to be out and about. You don't want to be kissing on, young kids. You don't want to have any kind of contact with people, just like we were with COVID. Like people were super, concerned about COVID. And if I had sniffle or sore throat or a fever, you wouldn't go out and about. You wouldn't expose people. Same thing goes for this as well. It's the common thread that everyone should remember is that if you have any symptoms whatsoever, you are probably contagious and you can spread this disease or any other hosts of numbers of viruses to other people who don't have it yet.
So I have a 2-month-old, but I have 3 other kids in elementary school.
Yeah.
And so I feel like the questions are kind of similar to ones we've talked about with COVID. What would you tell a nervous mom like me with a baby that she's healthy, but she's 2 months old. What would you tell me to do to get through this next season?
So I'll tell you that primarily the most of the kids that we're seeing in the emergency department who are 2 months old, 3 months old, the early ages, all have older siblings. All of them are bringing home this stuff. So it's inevitable. The older kids, for us, even for adults, for older kids, school age kids, kids who are able to, like 3rd, 4th, 5th grades and up, they just have a sniffle, a cough, maybe a low-grade fever. It's not a big deal for them. But what's happening is they're bringing these things home. They may not even know that they have, a cold or RSV. The parents may not know it, and they're kissing on the little ones, and then they get sick, and they're the ones that we see in the emergency department because they're having difficulty breathing.
Mhm.
So the best thing to do, especially if you have the older kids, I know they want to love on the little ones, and it's a new addition to the family, and it's exciting, but try to really limit that close contact, especially their faces. So I always say, if you want to give your baby a kiss, that's fine, but on the toes only. Just kiss their piggy toes. That's all you're allowed to do. There's nothing near their face. And try to limit the best you can. My favorite are when I hear the mom say, "Well, this 2-year-old, my 2-year-old really has no interest in the 2-month-old." I'm like, "Great. Keep it that way." I
Yeah.
don't want them to be interacting at all, especially through the winter months. Now, I mean, the
Yeah.
2-month-old has to get sick. Every human has to get sick. We will get sick. But just if we can get a little bit more meat on their bones, a little bit more age behind them, then they get stronger so they can fight off this, or not necessarily fight off, but at least be prepared to deal with the consequences of RSV and other viral illnesses, because no one's immune from this. I mean, that's the thing that people, parents are like, "Well, my kid's never been sick before," the 2 and under ages, and I call them the COVID babies, because they've never lived before COVID, so they've never
Mhm.
been exposed to the normal viruses that we get as humans on the day-to-day, especially in the winter months.
Right.
So they have to catch up. No one's immune from any viruses. We all have to get them throughout life. And so it's one of those things that you can't make your kid never get RSV, because they will, but giving them at least a little bit of age behind them, some strength with the musculature around, to support their breathing, will help them not
Mhm.
have to see me, perhaps this winter.
Right. I hope I don't have to see you.
No offense. No, I don't want to see you either.
I like seeing you here.
Yes, only here. Only here.
So talking about like a toddler, these COVID babies, how
Mhm.
do you see them in the ER, or how is it presenting in them other than just a cold?
So we do see them in the ER because, again, everyone is welcome to come to the emergency department. We don't have, rules and regulations about who can come and who cannot. So parents are concerned. A lot of these parents have never had their kids be sick. So it's more of a parental concern more than their kid is sick. I mean, I'm telling you, the news is making this extremely fearful for parents. And so the parents are coming in just because they want an RSV test. The kids are running around, they're playing, they're breathing perfectly well. They're not on any kind of oxygen. They've got Cheeto stains on their fingers. They're doing just fine.
Yeah.
But the parents are concerned because they've heard about this bad RSV thing on the news, and they're really worried.
Okay.
And so my advice to the parents is, don't be worried about what you're hearing on the news. Don't be worried about what people are telling you. Look at your kid. If your kid is in distress, if your kid is looking bad, that's concerning to you, not because someone's telling you you're concerned, but because you are truly concerned, then obviously come see me, because that's when we want to see you. Because
Right.
right now our volumes are so high, not because everyone's sick, it's because everyone's scared that they may become sick.
Okay.
So it does kind of burden the emergency department, because those kids who do need emergency care, who do need the support of oxygen, they're the ones who are really needing to be here, and the other ones are kind of making it a little bit, not that we don't want you guys all to come, you're welcome to come, of course, but
Right.
kind of take a pause for a second, say, do I really need to go to the emergency department? Can I see my doctor tomorrow morning? Do I need to do any of this because it's just a cold? So look at your kid, see how they're acting, and if you're concerned, then of course come to see me. But otherwise, it's a cold.
Right. So how are some ways that parents can treat their kids at home?
Yeah. So Tylenol, Motrin for any fevers, lots of fluids. If the little ones who are under 1, suctioning out their nasal passages. So Nose Frida is a wonderful, like $10 to $12 device at Target, Walmart,
Right.
CVS, all those places have it. It comes in a clear box. It's the best thing in the world. It's a suction device. It's my favorite one.
Okay.
And it's the best out there. So suctioning their nose will let them breathe better. So they'll be able to feed better. The infants are what's called obligate nose breathers. So they want to breathe from their nose because they have a bottle or a nipple in their mouth, for feeding. So they have to breathe from their nose because their mouths are busy eating. But if their nose is full of snot and congestion because of RSV or any other viruses, it makes it very difficult for them to eat. And so that becomes a problem too. So suction out the noses for the little ones, Tylenol, Motrin for comfort and fever support, and lots of fluids helps kind of just get over the cold symptoms.
Okay. And how long do you see this lasting?
If I had a crystal ball. So RSV usually before COVID was a seasonal event. So everyone would kind of get it around this time, usually a bit later. It's usually more, not so much September, October, but more like December, January. But this past summer, we had a huge, spike in RSV during the summer months. So and everyone's kind of blaming COVID with just everyone's behavior and patterns are different. So who knows? My hope is that it kind of burns through everybody, and it's done quickly, but not to be doom and gloom. I don't see that happening, to be honest. I think that just with this perfect storm of what I talked about being that we're just getting out of quarantine, that these kids have never been exposed to this virus before, everyone's kind of grouping together because of school and the cold outside. It's going to be here, I think, for a while. I really do. So it's just not that I want everyone to go back to the whole COVID quarantine, times, but we do need to just take stock in knowing that we have to do what's right for the community. We have to, if you're sick, if you have any kind of symptoms, don't expose other people to this because it does spread very, very quickly. And the most vulnerable, the very young, the very young and the very old are most at risk of getting complications from the virus.
Okay. So kind of going back to skip around a little bit, when you're treating at home and it just doesn't seem like it's getting better, what are the signs of I should call my pediatrician and talk to him tomorrow, or I need to come see you?
Yeah. And that's tough. Every parent's different, and it's kind of your level of comfort. If you need an answer right away and it's 2 a.m, then that's the emergency department. If it's at 9 o'clock in the morning and you've got walk-in clinics at your pediatrician, then that's a walk-in clinic kind of thing. Up to if you feel that way. If your kid is having difficulty breathing, and the thing is with infants, under 60 breaths a minute is too fast. So if their belly is going faster than your seconds are ticking on your watch, that is too fast. Because it's hard to coordinate a suck swallow at that speed, so they can't breathe and eat at the same time because it's just too fast. If they're purple, if they're blue, if they're having nasal flaring from their nose, sometimes people say retractions in the chest. I'm not so much about retractions as long as it's under 60 breaths a minute. So if they're breathing and they're sucking in and the breaths are more than 60 breaths a minute, I gotta see you as well. That's an emergency thing. So if they're looking like they're in distress, like my kid doesn't look right, don't pause, come see me, because that's an emergency visit for sure. If you think your kid's sick but can kind of make it, that's a doctor's visit.
Okay.
Yeah. I was gonna say one other thing about the concern that if you, I'm sorry, I lost my train of thought right there. That never happens to me. I was thinking about something I forgot. I'm sorry. I don't remember what I was gonna say. It'll come back to me.
Okay. If it comes back, interrupt me.
I will.
You have a respiratory clinic at the pediatric ER. Can you talk about that a little and how someone could get their child seen?
Absolutely. So it is by order only. So that means that your doctor, an urgent care, or the emergency department can sign an order that sets you up for this program. We have a dedicated clinic within the emergency department that you check in. You can come 4 times a day and up to 10 days from that initial order. You get evaluated by a nurse. You have your vitals obtained just to make sure you're stable, and then you get suctioned out by our vacuum wall sucker. It's amazing. And it kind of roto-rooters you out. It clears the airway and lets your kid, be able to breathe and feed better. It is for only 2 and under, because older than 2, it's very difficult to get them to hold still for suctioning. It's not really appropriate or necessary at that age. But if you have a question, you want to do, pardon me, do that, talk to your doctor and they'll get you the order. We used to, before COVID, you could come in anytime you wanted to, just because of the volume and just how many people we were having come in. It is by appointment only. So on the order sheet, it'll have a phone number that you call and we'll get you an appointment time throughout the day.
Okay. And this isn't the only thing I'm assuming you're seeing in the ER. So what else are you seeing that parents should know about?
So there's a lot of viruses right now. And so RSV is just one of many. A lot of people who do, like I said, come in, they want that test for RSV. I kind of discourage the test because it really doesn't change what we do. So there is RSV, there is influenza, there's parainfluenza, there's rhinovirus, there's enterovirus, there's COVID still. All these viruses kind of do the same things. So they all wreak havoc on the respiratory system: cough, congestion, runny nose, fever. and all have the potential to cause more difficulty. So for the majority of these patients, 95% of them, they do fine. It's just it's a cold. They have a few days of symptoms, they get better. But it's the ones that who don't. Again, they're very young and they're very old. They have potential of having difficulty breathing. And that's the concern that we need to see all of you for. If you're having difficulty breathing, if they're not able to maintain the saturations and breathe adequately on room air, they need our support, they need our oxygen.
Okay. And how is flu looking this year? Can you tell yet?
Not yet, thankfully. Enough RSV is enough right now. I've heard some people saying there's going to be this, triple demic kind of thing with COVID, RSV, and flu, and that's definitely a potential. But again, I don't hold so much stock in whether it's triple or quadruple or whatever. A virus is a virus, and if you have one, if you have two, if you have three, it's all the same. And I don't think it's as important, again, like I said, to name which virus you have. If you have symptoms, that's all I care about. If you're needing support, if you need help, then that's great. I don't care if it's, called the fun virus. It doesn't matter to me what it's called. So right now, flu, I'm not seeing a lot of them right now, which is good. Usually it's a little bit later in the year, but again, who knows what will happen. There's a few cases, but nothing crazy yet. But I do encourage everyone to get their flu shot. If you haven't gotten already, get it now. Today is a great day. We really recommend getting it before the end of October. We're still great. It's still good. There's never too late. But just with trends, we want to get it like now in order for it to really be as effective during the peak flu months, which is around February.
Okay. And then do you have any tips for a mom or dad that is going to bring their kid into the ER? Can they check online to see wait times, or what
We
do you recommend as they bring them in?
Yeah, it's hard to say. So we have at oprmc.com, there is, I think, a published wait time. It's not the most accurate, to be honest with you. And I think, to be honest, it's also the adult side. I've been talking to them for a long time about trying to get a peds calendar in there, but they haven't done that yet. So I think it's not as accurate. We don't give out wait times anymore. We used to, but the problem is with the volumes that we're seeing and the different levels of acuity, like how sick you are, we see kids based on how sick they are. So I advise the parents to bring, their phones, bring chargers, bring snacks, bring, perhaps a bag if you are being overnight, if you're staying overnight because of admission. So, maybe pack a light bag. All those things are good to bring in anticipation for waiting in the emergency department lobby. We try really hard to get people back very quickly. But just, it all depends on what we're seeing at that time. So I can't tell you, check online, that kind of stuff, because everything changes at any moment. We can have no wait times, and we can have 15 people check in, and then we go to an 2-hour wait time. So it all depends on just what's going on at that given moment. But do know that if your child is sick, you will be seen as soon as possible. And thankfully, and we ask for your patients too, that thankfully, if your kid is not as critical, you may have to wait a little bit longer so we can address the critical kids first, and then get to the not as critical children.
Makes sense. Okay, well, any last thoughts or?
No, I hope. It feels like we're kind of, back into the whole COVID kind of thing. But I think hopefully with this round and this kind of, the new phenomenon of viral, spikes, that we've learned from the past, and we know what to do and how to stay safe. And if that means wearing masks again, you're welcome to do so. I always wear a mask in the hospital right now. I'm not near anyone, so it's off, but it's right there. So I will be putting it on the moment we get off this call. So, do what's best to protect you and your family, and also the community. So if you are feeling at all ill, just limit your activity with other people, just because it's the best thing to do for everyone involved.
Great. Well, I appreciate your time, and hopefully things calm down, but we're grateful to have your expertise ready to help.
Thank you.